Hi, I'll be your nurse today and I'll be doing your sterile wound change. Can I get your name and date of birth, please? Okay. Jamie Smith. Okay, awesome. So, I just have a few questions before I start. Can you rate your scale or your pain on a scale from 0 to 10? 0, okay. And so you're feeling pretty good today? All right. It might change after I'm done with the wound dressing, so if it does, then we can give you meds. And you don't have any known allergies? No? Okay, awesome. Well, then I'll start. Oh, and I would have done hand hygiene right when I entered the room, but I forgot. So, I already did hand hygiene. I'm going to redo my hand hygiene. Take a pair of gloves. And then this label says to sanitize for 2 minutes, so that is what we are going to do. So I'm going to go 2 minutes. Keeping the table wet the entire time, making sure to get all the edges, and the table is already adjusted to waist height, but if it wasn't, I would have adjusted it before. Okay, now we're just going to change our gloves. Okay. So now I'm going to look at the wound. I'm going to maintain patient privacy the whole time. Okay, and I could see that the last time it was changed was 13/15. So we're going to change it right now. I'm also going to get my biohazard bag ready. And I'm going to get a pad ready to make sure nothing gets on the patient. Do hand hygiene and get a new pair of gloves. Okay, so I'm gonna take this off the patient, and when I do, I'm going to hold his skin just to make sure I'm not pulling and it's not pulling his skin. Okay, this is coming off very easily. I'm gonna assess for any drainage, any wetness, and there is none, so this can go in the normal trash. And now I'm going to assess the gauze one by one. Has no drainage in it. Okay, this has no drainage. And the last piece has no drainage. So that all can go in the normal trash. I'm now going to take my sterile tweezers. And I'm going to pull out this strip very carefully. Carefully not to touch the edges. I'm going to take note of the size of it and make sure there's no color. And that goes into the biohazard. This will go into the parts box, and this goes into the trash. While I am looking at this wound, I'm going to assess for RETA, which is redness, edema, ecchymosis, drainage, and accommodation. There's no redness, there's no edema, there's no ecchymosis, and there's no drainage, but it is not accommodated. It is still very open, so we're gonna redo that wound packing. So I'm going to perform hand hygiene one more time. And I'm going to open my sterile kit. I'm also going to open my saline and my strips. Okay, I'm opening my kit. I'm going to take my kit out. These can go into the trash. And then I'm going to open the kit. First, I'm going to open away from me. Then I'm going to open the sides, keeping the 1-inch margin. And laying it flat. I'm going to take my sterile gloves out. And then I'm going to take the corners. I'm going to flip my package. Make sure all the contents are out. Okay. I'm then going to take my saline with my hand covering the label, pour a little bit into the trash, and then I'm going to pour it a little bit into my container here. Pour it into my container here, then recap it. Okay, I'm gonna redo hand hygiene. And then I'm going to put on my sterile gloves. So I'm gonna take my package. Have cuff end facing me. Keeping the 1-inch sterile margins. Okay, I'm gonna start with my dominant hand. Place it in. Go in with my other hand, making sure to keep my thumb up. Now that I have those on, step back into the paper fall. First thing I'm going to do is take my sterile tweezers and my scissors, and I'm going to grab a piece of this. That's no longer sterile, so I'm actually just gonna I'm gonna pretend like that didn't happen, and we're just gonna say that that didn't fall. It's still sterile. Obviously, otherwise I would not continue using. So now I'm gonna pick it up, and I'm going to cut about where the other one was at, so it's the same length, and I would not have dropped it that time either. Have this, I'm gonna put it into my saline solution. And I'm gonna put these scissors down. Okay, next I'm gonna take my gauze. I'm gonna take 3 strips. So that's 1, 2, and 3. I'm gonna put them into my saline. Make sure they get completely saturated. Okay, now I'm going to clean the wound by taking the corners, squeezing excess, and then I'm gonna start in. So go around the wound closest first. biohazard bag. Take my second. I'm going to take it by the corners again. I'm going to go a little bit farther. Biohazard bag. Then I'm going to take my last one by the corners. Squeeze it out. And I'm going to go a third time. So now I'm going to take my strip, take off some of that excess. I'm going to grab my sterile Q-tip. I'm going to wrap it around a couple times. Take the end of it, and we're going to put this into the patient. Being very careful not to touch the other sides. I'm going to unravel it, and I'm going to use it to go in there, leaving a little bit out to make sure we have a tail end. Okay. So now I'm going to cover it with gauze. Take one at a time. This I also would have pulled back more to begin with, so it wasn't touching the wound. Our third piece. And then our second piece, and then our third piece. Put all this on. Now we're going to take our big bandage, open it, and place it down. Okay. Now we are no longer doing a sterile procedure, so I can take off these gloves. And for the sake of the video, I will pull this back some more. So now we're just going to tape it off. We're going to tape all 4 sides. And he does not have any allergies to the tape, so we don't have to be worried about that. We're going to make sure it's secure so it stays sterile in there and limit the risk of infection. Okay, and then lastly, I'm going to write my name on a piece of tape. Normally I would also already have a pen. So now we're just gonna write, I'm gonna write my name, my initials, the time, and the date. Okay, and then we're just gonna put that right on top right there. And then of course, gonna repeat hand hygiene. The rest of this stuff will go in the biohazard or the trash, and that's it.